Hello, everyone, and welcome to our second in the series of the Global Ambassadors Speaker Series. I am so thrilled today to have the privilege of welcoming all of you. I appreciate you taking time out to join us for what I know is going to be a really stimulating conversation, really a great panel, as you can see from the names and the pictures posted here on our first slide. I'm delighted that this distinguished panel has agreed to join us, and I am going to turn it over to Brian Dotson, who leads our food security work, and he is going to introduce people and tell you what's ahead. So Brian, over to you.
Thank you, Ann. Counterpart is thrilled to be hosting this Global Ambassadors panel discussion today. Food insecurity, consistently having enough of the right foods to eat, is a fundamental human right that more than 2 billion people do not enjoy. The COVID-19 pandemic is making the world more food insecure by the day. It's damaging local food systems, revealing the fragility of long supply chains, increasing food prices, and reducing remittances from abroad, on which so many of the world's poor depend. Counterpart is honored to have the support of our partners to combat food security in Guatemala, Senegal, Mauritania, and Mozambique, all countries where the pandemic is hitting with increasing ferocity and with no end in sight. We are all lucky today to have the opportunity to hear from and ask questions of some of those on the front lines of that work, who I'll ask Jennifer to introduce in a moment. In the meantime, I'd like to thank everyone for coming today, and especially for the work that you do to combat food security around the world. Thank you. Jennifer?
Thank you, both Brian and Ann, for your remarks. We're very grateful to have you here today and for your leadership in food security programs at Counterpart. So before we begin, I just want to remind everyone that this is being recorded and that we have reserved 10 to 15 minutes at the end for participants to ask questions to our panelists. So if you have a question along the way, you can drop it in the chat and it will be answered at the end. And then during the Q&A, you can use the Teams feature to raise your hand to ask a question. So today we have with us 4 experts in food security that direct and manage very impactful work around the world. First, our moderator is Norma Toussaint. Norma is a senior program leader at Counterpart, and she manages USDA-funded programs in Senegal and Mauritania. Norma has over 10 years of experience providing project oversight for U.S. government-supported projects in both not-for-profit and for-profit global arenas. Thank you, Norma, for moderating for us today. Next, our panelists include Ester Bucaro, Kathryn Lane, and Allison Lacko. Ester Bucaro is Counterpart's legal representative and programs director in Guatemala, where she manages the Food for Progress program funded by USDA. Maria is one of the first women to lead agricultural programs in the country and works face-to-face with high public officials and local and international universities to implement the Rural Extension Program in Guatemala. Next, we have Kathryn Lane with us today. Kathryn is the Chief of Party for Counterpart's USDA-funded program in Senegal. She has over 25 years of experience and actually began her work as a Peace Corps volunteer. Kathryn has now lived in Senegal for 10 years, where she has and continues to work with USAID and local and international NGOs. And thirdly, with us, we have Allison Lacko. Allison is a senior nutrition policy and research analyst at the U.S. organization Food Research and Action Center, also known as FRAC. Allison is responsible for providing research and analysis that support FRAC's advocacy to address the root causes of hunger and strengthen the U.S. federal nutrition programs. So I really want to thank our panelists and moderator for all of their work on this and for all of their time spent with me organizing this. We can go ahead and get started, and for our participants, you're welcome to have your video on or off. And yeah, if you have any questions along the way, just feel free to drop them in the chat and they'll be answered along the way. Thank you so much for being here today. I'll pass it to Norma.
Great. Thank you so much, Brian and Jenny, for that intro. Again, I'm Norma, and I'm really excited to be here today. Before we get started with our moderated discussion, I want to establish some key definitions that we'll be using throughout the moderated discussion. First off, food security means that all people at all times have physical, social, and economic access to sufficient, safe, and nutritious foods that meets their food preferences and dietary needs for an active and healthy life. The 4 pillars of food security are availability, access, utilization, and stability. Lastly, food system is simply described as everything that goes into producing, processing, distributing, and consuming foods. With that, let's get started with our first question. COVID-19 is simultaneously impacting food systems and public systems around the world. The UN warns that global poverty is projected to increase for the first time since 1998, reversing decades of global progress in nutrition and hunger. During the first wave of the pandemic, how did COVID-19 impact your respective programs? What are the current impacts and future implications? We will start with Allison with the US perspective.
Hi, everybody. I want to start by thanking you for inviting FRAC and myself to come talk at this panel today. We're really excited to be here. I'm going to talk about the food trends in. So FRAC gives technical assistance to state agencies and local organizations, and is a leading anti-hunger voice in the U.S. We don't have specific programs per se, so instead I'm going to talk about the general trends and what we've seen in food hardship in the U.S. We've seen increases in poverty, we've seen increases in food hardship. Prior to COVID, disparities existed in who was impacted by food insecurity. We don't have the way that food insecurity is measured in the U.S. Through the census is something that comes out, almost a year after the year in question. So during the course of COVID, we've been measuring food hardship a little bit differently just to get real-time data on what food insufficiency has looked like. But the same disparities that we saw prior to COVID in food insecurity, we also see in food insufficiency. So food insufficiency is something that the census has been assessing by asking people, do you have, in the past 7 days, have you had enough to eat? So people either answer that they've had enough to eat of all the foods they want, they've had enough to eat, but maybe not the kind of food that they want, or sometimes or often don't have enough to eat. So if somebody answers sometimes or often they do not have enough to eat, they're considered food insufficient. So what this graph is showing is how food insufficiency has changed over the course of the pandemic. It stayed pretty low in the early months of the pandemic. This graph is split into 2 pieces because the survey the methodology changed a little bit. So that jump between July and August might be a function of survey design, but the overall trend, especially when looking at disparities, has been pretty consistent. Food insufficiency has increased in the second part of the year. A lot of the federal safety net programs expired. And you can see in January that food insufficiency dipped a little bit with the passage of recent legislation to support individuals and families. But the same kind of racial disparities that we saw prior to COVID have continued during the pandemic.
Thank you so much, Allison, for that. And as we see, data is very important. Mary Ester, let's hear from you for the Guatemala perspective. While we wait for Mary Ester to get her tech together, let's go with Kathryn. Kathryn, are you with us?
Yes, I am. Hi there. Okay, so let me just talk a little bit about the impact of food security in Senegal. I'm the chief of party for our program here. So basically, to try and sum this up in a nutshell is not easy, but the pandemic, what the government did was they started a 3-month partial lockdown. They had no travel between regions, time curfew, and they halted a lot of the economic activities that happen in Senegal. Obviously, big negative impact on that. Schools were also closed. This lockdown was actually from March to June in 2020. So basically now the question was, what's the impact of COVID-19 on food security now? And it's an ongoing thing. I think a lot of the most severe results were felt back in March and September of 2020. And with what little data we have, unfortunately, data collection was a challenge before COVID, and it remains one now. But we do see that the impact between urban and rural zones was different. And of course, we see that there is a big difference between the impact on women and men. There was actually a World Bank survey back in July of last year, and it showed that 85% of households stated that they had had a decrease in revenue. However, one of the interesting parts of that was that families that were relying on agriculture, fishing, or livestock, they actually had less significant disruptions. So we can say that availability of food at the producer level in rural areas was a little less impacted. However, accessibility was greatly diminished for everybody. Less income reduced household capacity to purchase quality food in sufficient quantities. Because around 90% of the Senegalese economy is rooted in the informal sector, where wages are low and work is precarious, the lockdown just basically knocked the breath out of the informal economy. As money flows, they shrunk. Farmers and herders, for example, couldn't sell their products. There was another survey that was done by this was in November of last year, where members only in agricultural families that were getting their livelihood from agriculture. And that survey showed that 14% of their members reduced their number of meals, 33% reduced the quantity of food per meal, and 42% reduced the quality of their meal. And quality was directly related to consumption of meat, vegetables, fruit, dairy, all the things that have lots of good nutritious value to them. So food utilization was also negatively impacted by the pandemic. Unfortunately, the impact in urban areas was a lot worse. There were higher rates of COVID-19 transmission, so the direct health impact has been higher. Revenues from all the things that people do here to make money, from petty trading, street food production, tourism, you name it, it all plummeted. Senegal, fortunately, has not seen price increases that are related to the pandemic. But nonetheless, there was another World Bank, it wasn't World Bank, government survey that showed this one showed for non-agricultural households that 23% had reduced their daily meals from 3 to 2. And that's a big reduction in food. And women, and I say of course, because unfortunately that's what research always shows, women carried the brunt of this because they had a decreased income, they had increased childcare duties, and then they had the added responsibility in many cases of caring for sick family members. Part of this question was, what was the impact on our project? And so I just want to, our McGovern-Dole International Food for Education and Child Nutrition Program focuses on community-led school feeding. We also have a component that looks at local food procurement. We're in about 270 pre and primary schools. And it's really easy to say what the impact of the lockdown was. When the government of Senegal shut down schools, all of our activities kind of came to a screeching halt. We had no trainings, we had no community meetings, and of course we had no school meals because the kids weren't in school. And we know there was an impact on their access to nutrition just because the amount of food that they were getting was reduced. Like everywhere, we quickly pivoted to virtual work, and we tried to figure out what to do. We have 4 implementing partners, Save the Children, CLUSA, Virginia Tech, and ARED, which is a local NGO. And we had lots of moving parts with partners, with the government of Senegal. So basically, long story short, we kind of put ourselves in a contingency plan mode, and what do we do next? So I'll stop here because then we move on to the next question. Norma?
Thank you so much, Kathryn. Mary Ester, are you here with us to give
Yes,
the
I'm here.
Okay, thank you.
Can you hear me now?
Yes, perfect.
Good. I'm so sorry. Always something going on. Yes, well, basically prior to the pandemic in Guatemala, unfortunately, Guatemala has the highest malnutrition indicators in Latin America, only surpassed by Haiti. At the same time, Guatemala had a deficit of 3.5 million formal jobs. 7 out of 10 jobs are in the formal sector, which made them sensitive to disappearing. On March 13th was the first COVID-19 case detected, and the government of Guatemala makes the decision on March 16th to close all types of non-essential activity, which included grocery stores and marketplaces throughout the country. This disrupted the whole food value market change. There was no time for the population to take protective measures or to safeguard food. The government did not have a clear plan or strategy on how it will face the economic social situation of the country. Given the activities restrictions in the country, our Food for Progress program funded by USDA in Guatemala was affected because we were unable to provide technical assistance, training on in-person, provide financial credits to the country's producers groups. We have to look alternatives and strategies based on innovation and technological platforms in order to reach out beneficiaries. A state-of-the-art emergency situation room was installed in the Ministry of Agriculture to support the implementation of the strategies to be followed in the fight against the pandemic. Later, this room, this was used in the management of emergencies caused by the tropical depressions Eta and Iota in 2020. All our trainings with the Ministry of Agriculture level continue in a virtual way by connecting the extension workers with teachers from the USA, Mexico, Chile, and Guatemala. We achieved a graduating class of 39 extension workers from the ministry on December 2020. We are currently implementing grants to help producers groups to help them out. And we do it through online systems, financial credits, and online market platforms are being prepared. Technical assistance and training for producers are being carried out on television, online, and in person following epidemiological protocols. So basically, we have to innovate, Norma, in our program, and so other programs are doing so. So back to you, Norma.
Thank you so much. There's definitely some themes and some similarities when it comes to the impact across our programs. Let's move on to the second question. So globally, response to COVID-19 has differed from one place to another. So we started off talking about impact. Let's shift gears and talk about the response. How has your respective countries responded to COVID-19, especially in terms of food security? Let's start with Senegal. Kathryn, over to you.
Okay, gotta get everything unmuted quickly. Okay, so interesting what you were saying about Guatemala, because Senegal actually put together a really hefty response to address what happened to the ensuing crisis when the lockdown was instituted. And remember, the lockdown was for almost 3 months. Basically what they did was they put together a package to directly address food insecurity, direct healthcare needs, assisting vulnerable households, and they also tried to address some medium-term impacts in the formal sector economy. I'll just give you a brief overview of kind of what they did. Their package was $1.8 billion. And let me remind you, it's in a country where the GDP is only 23 billion. So they put together a $1.8 billion package. And this was a mixture of all kinds of things. But anyway, that's what they put together. There was $118 million to cover all medical care for COVID patients. So it was free of charge to everybody. They gave assistance in water and electricity to approximately 700,000 vulnerable households. And then they put together 127 million for direct food distribution. Basically, they published a food basket and they started distributing it to 1 million families. It didn't always go smoothly, but it was impressive what they were able to do. They also used fiscal policy to do things like monetary support, tax breaks, and access to credit. And a lot of that, I'm sure, went to, or I imagine, went to major players in food importation and distribution. So Senegal has actually been widely praised for its pandemic response on an international level. And they're very effective. I think it's important to point out their very effective communication campaign, because they reach the farthest corners of the country. They stopped rumors and they rallied people to respect health barriers, from the president all the way down to the nurse in the health post in the rural communities where our schools are. How did Counterpart respond to the pandemic? Well, we scrambled like everyone else at first, but basically we succeeded in transforming a school feeding program into a rural food distribution exercise. It wasn't easy. I kind of like the analogy of getting an ocean liner to turn on a dime, because that's about what it was. We had the full support of USDA. We had the full support of our partner DCAS, which is the Senegalese government authority that manages school feeding. And we had the indispensable participation of all the education and health authorities at the community level. We learned a lot about contingency planning, let me tell you. Basically, just to give you an idea, prior to COVID, in an average month, we would have served about 580,000 meals to about 45,000 children. We transformed that into a one-time distribution to about 25,700 households, serving over 108,000 kids. In food amounts, we distributed about 666 metric tons of rice, cowpea, lentils, peas, and millet. And don't have a picture in your mind of like cars lined up at food banks like in the US with boxes popped into trunks. No, this was a distribution that took place in rural villages with poor access, and in the rainy season, where women showed up at the school, picked up their sacks while having to respect the health protocols, and then carried about 25 kilos back home. We had health officials actually on the site helping us to make sure everybody's safety was taken into account. Just as an aside, the distribution list for the take-home rations, this was something that was only for schools, but it had to be absolutely transparent and a consensual process that took a lot of time and a lot of effort. So in addition to the school feeding, we also did things like help school and education authorities prepare for reopening, cleaning products, disinfections. We helped with hand washing stations, thermometers, masks, hand gel, all that kind of stuff. And we also put on the air an intensive campaign in local community radios to talk about how to stop the transmission of the virus. Basically, long and short of it is that we temporarily totally changed our project. And it wasn't, so this was from March to about September of last year. And it wasn't until October that we started transitioning into kind of normal, regularly planned activities as we prepared for schools to reopen, which they did in November of last year. So I'll stop there.
Thank you so much, Kathryn. I know in your, you mentioned long lines, and that's an image that has been seen by a lot of us, especially in the US. So I will ask Allison for the US perspective on this question. Allison?
Sure. So Kathryn, your comment made me laugh. The US has not been recognized internationally for its response to COVID. But there have been some bright spots, and we are optimistic with the Biden-Harris administration. So specifically for food insecurity, the US has a series of federal programs that serve as a safety net. So I have the kind of like broad overview, and so it's like a quick food security program 101 in the US. There are a mix of entitlement and block grant programs. So an entitlement program just means you know, if you meet the requirements for a program, then you get the money. The state is not given like a budget for something that they have to ration out. So the largest program, far and away, the Supplemental Nutrition and Assistance Program. That is a program that is very responsive to economic hardship. So as need increases, as long as people qualify via their income, then they receive benefits. So it's it's one of the most equitable safety net programs for that reason. States, there are federal guidelines, and then states have some flexibility in, especially in SNAP, for some of the other programs as well, to administer the program with different waivers and extensions. And over the course of this past year, a number of waivers and expansions for these programs have been put in place and offered to states as long as the country declares a national emergency. And the Biden administration has indicated that they're going to keep that designation of a national public health emergency until the end of 2021 at the very least. So we have seen SNAP enrollment increase dramatically, especially in the first couple months of the pandemic. Enrollment increased by about 16%, and families were allowed to claim the maximum number of benefits for their household size. Recently, the Biden administration is pushing for an extension in their upcoming negotiations to expand benefits by 15% for families. That was something that passed in December's COVID relief bill to provide more access for families. So SNAP is primarily a food insecurity program. There aren't there's a very minimal set of foods that are restricted that you can purchase through SNAP because the purpose is food security. Families are allowed to purchase the foods that they prefer and that they have access to. And that program, like I said, enrollment has increased, and the level of benefits that families have been able to receive has been expanded. And there have been some, waivers to extend to kind of eliminate the kind of administrative requirements that would make it difficult for families to reapply. The other program that I want to highlight specifically are school meals, because one of the main income stresses for families during COVID has been the loss of getting breakfast or lunch through schools. So that's increased household family costs and has increased food hardship. So in light of schools being shut down, school districts and state agencies really put forth quite a heroic effort to try to first distribute meals to kids early on in the pandemic. And then the government started a program called Pandemic Electronic Benefits Transfer, or Pandemic EBT, where benefits are issued to families much in the same way that SNAP benefits are. So a family receives an electronic benefits card that they can use to make purchases. This program has gone through a lot of trial and error, but it's definitely been a bright spot because it's been innovative. State agencies and school districts have been supporting each other and trying to figure out the best way to get these funds to families. And it works out to the Biden gave an executive order in the beginning of his term to raise benefits for school meals by like 15%. So right now it works out to about $6.82 per child per day is the reimbursement that families are getting to be able to replace school meals as long as their school is virtual or going through a hybrid model. So there have been a ton of moving pieces because there are a lot of programs. And then, the three major relief packages that have been passed in the US in 2020, two of them were passed in March, one of them was passed in December, have also provided income support for families through either rental assistance, supplemental unemployment benefits, support for small businesses, stimulus checks for individuals, and all of those pieces. A lot of things have been very patchwork, and the lack of predictability. We can see you could see the effects of those in that food insufficiency graph that I showed earlier, that there was an increase in food hardship when these programs expired, and then a decrease when these programs were put back into place or expanded in December. So the response has been patchwork, but there have been some bright spots, and hopefully will have implications for food security, safety net policy going forward.
Thank you so much, Allison, for that very thorough and informative response. I know I'm learning a lot about U.S. federal food programs. Mary Ester, let's hear from you for Guatemala's response.
Yeah, in our case, the government of Guatemala took full responsibility for the response to the country's pandemic and restricted all mobilization, transport, and work activities. Congress gave full support to the Guatemalan government by approving large amounts of funding to implement aid programs. Unfortunately, the government was unable to delineate a strategy to plan and effectively implement these programs. The government promoted economic aid to families, but did not reach the neediest. For example, cash vouchers were provided to families only if they submitted their electric bills. This hindered aid to the entire population in extreme poverty who do not have access or cannot afford electric energy. Food supplies were provided by the government in small boxes, which unfortunately did not meet the nutritional requirements nor were sufficient for rural households. Many formal jobs were lost, small and medium companies shut down, and informal jobs were lost too. The result of all these actions led to the increase of unemployment, lack of money to purchase essential goods, and the increase of hunger. This led for the population to adopt a system of waving white flags or posting them at their homes to indicate that they lack food to survive and were asking for help. Now, this happened not only in the rural areas, but the urban areas too. Any organization that would have liked to support or provide assistance could only do so through the central government. For this reason, Counterpart, through its Food for Progress program funded by USDA, helped the Ministry of Agriculture to set up the situational emergency room, which I talked to you about a couple of minutes ago. And it has proven in several occasions very useful because they have been able to assess the affected areas in real time and bring immediate help to these populations. We also continue providing financial credits in the Western Highlands, grants, technical assistance, and trainings through TV, online, other platforms, in person, following the protocols established by the government in order to establish the food value market chain again. We have the full support from USDA and the Guatemalan government to continue our work. It has not been easy at all. We have to bring a lot of innovation, a lot of creativeness around it, but we have been able to continue our work in Guatemala. So back to you, Norma.
Thank you so much, Mary Ester. Yes, a lot of similarities in terms of moving pieces and collaboration and pivoting to respond to COVID. So our last question is, the root causes of hunger and health disparities are very similar, especially in terms of access, availability, acceptability, and affordability. What opportunities does COVID-19 offer to build back better? Let's start with Kathryn.
Okay, I love talking about. Okay, so let me start. I think that even though COVID-19, obviously, this pandemic has been an awful thing, we can use this disruption for an opportunity for change. I used to have a professor who always said you had to break eggs to make an omelet. I love that. So let me just talk at two levels, the policy level and then the project level. If I had to choose one part of the food security tapestry for which COVID kind of is offering us an opportunity, I would focus on local food production. I think food self-sufficiency is glaringly necessary to overcome something like a pandemic. The government should strategically invest even more in pertinent agriculture, fishing, livestock, dairy, value chains here in Senegal. And of course, I think there should be a big focus on women and small farmers. Everything showed that when you have to mobilize food and get it to people quickly, when you can do it locally, it works better, it's more nutritious, and it's a cycle where when you procure locally, you add money to the economy. So it's a positive cycle of reinforcement. Let me add another thing. I think just if there were a second thing that I would use COVID as an excuse to try and address, it's the lack of effective nutrition knowledge and public health campaigning around habits and norms in the way food is eaten and prepared here. Because I think not only will that improve child nutrition, child and youth nutrition, but it would also address public health issues like there's a lot of diabetes, there's a lot of hypertension here. And actually we know that those are comorbidities with COVID. There's also, we talked about quality of food. I talked about quality of food earlier. Junk food, street food, that's unfortunately something that's gaining ground here in Senegal. So if we were just going to look at policy areas, those are two things that I would say let's use COVID to address. More specifically, our project is focused on linking local production of cereals and legumes with school feeding programs. So I think this is an excellent opportunity to very specifically build the linkages that you need to have between school feeding and local farmers. And the government has a key role to play in that, both financial and regulatory. So I think if we could strengthen those linkages, the impact has lots of positive reinforced results. Counterpart is advocating here for a really robust school feeding program that's community managed, where leadership is really at the grassroots level. So getting those public resources to complement what communities themselves provide is a win-win situation for everybody. And one thing that we saw from what the government mobilized, the government of Senegal mobilized, they got the private sector to contribute a lot of money to that 1.8 billion package for COVID assistance. So the local private sector, and not just big, there was a couple of big international players, but a lot of it was local companies. The money's there. We got to figure out how to get them to use it to fund sustainable school feeding here in Senegal. So that's kind of at the larger policy level. Let me just touch briefly on, at a project level, what the opportunities that COVID has offered us to be innovative. So in terms of program management, we realized that we were really unprepared for all the things that we had to do to begin a response to the lockdown situation. We had to identify needs. We had to figure out what our project could do within its limits of scope and budget. Then we had to figure out how to carry out all these things in spite of procurement, logistical, and technical challenges. Communication networks, communication was not set up to be able to have rapid information exchange and decision making. So we just realized that we were not prepared for it. So I think at a higher level, this is an opportunity to advocate for all development projects to be designed from the get-go, to be more agile, and to be able to respond to changing circumstances, rapid like a pandemic or a climate related catastrophe, or even like slow progress on policies and things like that. We need programs that are more agile. On a technical program level, we had some interesting, I think Maria was talking about how, and Allison was also talking about how people have kind of adapted and tried to respond to what was going on. And we had some innovative technical programming. So for example, we trained people without bringing them all together. So we did some of that virtually. And now post-lockdown, we're using it as a way to look at our curriculum, our training curriculums, and how can we make them more interactive? How can we do them in smaller groups? How can we bring training to participants instead of participants to training? Another thing that we adapted to were we have reading clubs as part of our as part of our activities. And so instead of bringing together kids for reading club meetings, club volunteers actually went and did home visits, thereby reaching a smaller number of children, but with more intensive support. Another thing we did was the government produced a health and nutrition guide that has COVID specific information. And so we said, okay, let's print a whole bunch of these and use them in our nutrition trainings at the school level. So we kind of piggybacked on what the government was already doing. We used community radio for reinforcing literacy learning. Children loved it. Story time with Q&A, and that actually piggybacked on something that the government was doing, because we do school feeding and we do health and nutrition, but sorry, I forgot to mention earlier, we work on school infrastructure, and we also have a component to improve literacy outcomes for elementary school students. So we kind of piggybacked on what the government was doing with radio and television lessons, to try and also use that to kind of stop the bleed, stop the gap when children were out of school. And just as an aside, the Ministry of Education found that the radio messaging around literacy was extremely effective, and they had standardized test scores for the first time that were greatly improved. So anyway, there's other things, but I'll stop here.
Thank you, Kathryn. I know we can have a whole session just on Senegal, but let me give Ester some time to speak on opportunities for Guatemala.
Yes, well, basically in our program, like I was saying, we had to innovate, we had to create, we had to, like I said, fast track, use the internet more. But basically, thinking about this question, the COVID-19 pandemic uncovered the reality of countries in terms of the inability to respond to a major emergency. It demonstrated a worldwide weakness in the health system and an inability of the economic system to support a population that needed help to survive. Closures of economic activities were decreed without funds to meet the basic needs of each household, at least in Guatemala. Furthermore, non-payment of public services were partially protected, but formal and informal employment was not. The COVID-19 pandemic changed the way many companies work in country. Teleworking was adopted, and the need for physical facilities decreased dramatically. E-commerce was also generated and increased as a way for the population to stock up on essential products. The internet became essential service for companies, for schools, for government, and for NGOs. Internet is a key piece here because it's being used to provide classes in school, classes to other, at least in our case, extension workers, technical assistants, sales. So there's a new future in companies. There's a future, a new way of dealing, new ways to bring back employment. So basically, innovation is a new way that has come out from COVID to existing markets and foster flexibility, creation, imagination, and adaptation. So basically, the new normality brought a new work-life balance and also reignited activism and a need for change. So this is what I have for you as a response to your question, Norma.
Thank you so much, Mary Ester. Allison, over to you.
I think this is a really important question because the root causes that contribute to disparities in health and disparities in hunger are very similar. So, by root causes, I mean the structural reasons for inequities that we see by gender, by race, ethnicity. Those kinds of things include, structural racism that's resulted in job segregation, wage gaps, neighborhood redlining in the United States that has resulted in disinvestment from communities that results in differential access to health services and access to healthy food and affordable housing and educational opportunities. So those underlying structural factors have resulted both in the inequities that we've seen in COVID outcomes, as well as food insecurity outcomes in the United States. And, we see these national trends, but also differences by geography as well, comparing the trends in the southern United States to other parts to the Northeast or the West Coast. I think that the combination of COVID highlighting these or really exacerbating these disparities and putting them front and center, along with the the racial reckoning and the uprisings that happened in 2020 as well. I think the confluence of those two things, plus the new administration, presents an opportunity. I don't know that any of those things separately would present the same opportunity going forward. But we are optimistic going forward about what can be done to address these, to address food insecurity and these more structural issues. For the federal food programs specifically, the Biden administration is interested in increasing SNAP benefit levels on a more permanent basis. Right now, benefit levels are inadequate to be able to afford a healthy diet once you take into account the cost of the time to prepare food and the cost of healthier food in the U.S. So there's been a big push to increase the adequacy of SNAP benefits, and we hope that that's something that we're optimistic that that's something that we'll be able to move forward with, especially because so many families that never had to rely on food banks or SNAP prior to COVID all of a sudden found themselves seeking out food assistance programs. We're also optimistic about what we've learned from PEBT to replace school meals. So that's the innovative program that I mentioned before that gives families access to money to pay for food while they're the families that would have received free or reduced price meals while their kids are not going to school. Families are receiving money, and what had happened before over the summer is that these families, there were meal distribution sites where families with children who had received free or reduced price lunches could pick up food over the summer, but uptake was very, very low. So we hope that this expansion of this innovation with PEBT will be able to transfer over to summer meal programs moving forward, so that families can receive reimbursement for that food instead of having to rely on these meal distribution sites over the summer. In general, the reliance on going virtual means that we think that the administration of these programs will be more flexible going forward in terms of allowing, tele appointments and enrollment over the phone and kind of upgrading technology, as well as purchasing food online and getting reimbursed for having groceries delivered. And then in terms of addressing the root causes of health, we're optimistic that the Biden-Harris administration is how they're approaching centering communities, especially Black, Indigenous, and people of color in the discussions that they have about different policies moving forward in terms of housing, in terms of the racial wealth gap, in terms of different employment opportunities and job segregation, especially the conversation around what it means to be an essential worker. I think that all of those conversations are going to be important going forward in advocating for a living wage and different job and education opportunities. And access to broadband, like Maria Ester said, it's important in Guatemala. It's also very important in the U.S. And I think that's another thing that is going to be prioritized going forward in the wake of COVID.
Absolutely, absolutely. Thank you so much, Allison. Definitely. Let's open it up to audience questions. We have about 8 minutes left in the session. So I think there may be some questions on the chat. Jenny, I'll let you sort of moderate that session.
Yes, there's no questions in the chat. I did notice somebody raised their hand around during the first question. So if that individual has a question, feel free to shout that out. Or if anyone else has a question, feel free to raise your hand and we'll get those answered. Thank you, Anne. If there's no questions, I think we had an additional question. Oh, Anne, thank you. What concerns do you all have about the supply chains as of now? Thank you, Anne.
Mary Esther, do you want to answer that question from the Guatemalan perspective in terms of supply chain?
Yes, sorry about that. Always some internet problems here. Yes, we do have concerns about the food supply because this was disrupted last year. It hasn't been easy to get it back. And especially now that the tropical storms hit Guatemala. And the worst part is that it hit the area that produces the more staple foods in country. So yes, we are concerned not only because of COVID, but also because of the natural disasters the country is facing. So yes, we have to work very, very hard to restore the food value chain in the country and also to work for employment. We need that. Basically, Guatemala produces food, but the problem is the access, the money that people need to purchase those products. Okay.
Great. Let me add something here. One of the, when you talk about the whole food chain, one of the benefits of an informal economy, which is here in Senegal, is that it rebounded relatively quickly. This was not a natural disaster where field crops and production areas were destroyed. So as soon as the lockdown ended, people rebounded. And then there was some worry, like at the end of the agricultural season or last year, because during the lockdown, farmers were eating the seeds that they were going to use to plant in their fields. That might have impacted the agricultural season last year, but in fact it didn't. Senegal got lucky, and the rainy season was plentiful and well timed. So the agricultural season, the amount of food that was produced last year doesn't appear to be significantly impacted by the lockdown. So in the big picture, the food production chains haven't been that impacted, but I think it's more the access where people lost a lot of money. And when you're on the margin and you lose money, you lose income, it's really hard to get out of the hole and try and you miss rent, or you don't have money to take care of somebody who's sick, so they get worse, et cetera, et cetera. So I think it's more the long-term effects of a loss of income that's indirectly having more of an impact on food security than the actual supply chains themselves.
Thank you. So we have a few questions in the chat if we're able to answer one or two of those very briefly. So one question is, how can we help government and communities increase their response capacity to face these types of emergencies? Whoever would like to go first.
Okay. Allison, you want to go?
Sure. I think
the kind of underlying lack of investment we had in our public health infrastructure here in the U.S. Certainly contributed to the uneven response to COVID. So I think recommitting to investing in public health infrastructure, and like I said, investing in these root causes. I think that the U.S. with all of the autonomy that different states have provides for opportunities in some areas and a lot of challenges in other states. So making sure that there's in terms of COVID, kind of strong leadership from federal agencies and the federal administration will be really important in helping states, and then having the capacity to get their feedback quickly on how to adapt these programs and be innovative in the future.
Yeah, I think the question's a really good one, because I'm just thinking, I think I read somewhere that Germany had put aside funds way back from HN something, a decade ago. They started putting money aside to deal with the pandemic. And then when this hit, the government itself already had money to start responding. So planning is essential on a leadership level. But then the question about what can governments and communities do, it's interesting. I've seen some interesting community work where in conflict zones where communities kind of prepare for what happens if. And when they do that really at the local level, within villages, within districts, and you've got a whole system in place that if something goes wrong, this is what happens. So I've seen that in crisis, in conflict zones, but nobody saw this coming, and nobody prepares for anything until it's right there for something like this, I think. So I don't know. It's a really interesting question. Organizing people at the community level is one thing. I think really it's a lot of government leadership to try and figure out, okay, we need to have a contingency plan and action so that if this does happen, this is what we're going to do. And then from that, you can get things happening at the national level, and then at the regional level, and then down at the local level. Maria, Esther?
Well, in our case, yeah, like you're saying, the government has to be the one that takes the leadership. In our case, Guatemala government needs to be transparent, show that it cares, show that the food programs are there for everybody to access. And the communities need to work with the government. The pandemic is only going to be handled by everybody. We're all affected by all means. So yeah, we have to, get that trust back in the country that is lacking at this moment.
Well, thank you. I know we've hit our time. It's 2 o'clock. Before everyone starts to drop off, I do want to thank everyone for joining us for this session. This was very interesting. I myself have learned a lot, and I'm happy I was able to have the privilege to moderate this session. So please, thank you again. And please visit Counterpart's website for more information about our programs, and also FRAC's website to learn more about the research, the important research that they're doing about the food security programs and anti-hunger work that they're doing in the U.S. If you have more questions, if the speakers want to stick around and answer, please feel free to. But I have to pick up my 4-year-old, so I just want to say goodbye and thank you.
Thank you, everybody.